SeeJeanty back at it again, and man, it's a beautiful rainy day here in South Florida, but we're gonna do our best to stay dry, and we have to stay dry as we enter this space. I don't wanna wet the floors, I don't wanna soak up any of the seats because it is a medical facility. We want folks to feel appropriately correct. And this facility, I can tell you right now, it's a place that has been a cornerstone of the community for over 30 years. It's a multi-generational facility where father has passed and now the son has taken it over. A Haitian family, a Haitian dynasty that's serving the community here in South Florida for that entire period, which is now spanning to include the time the son has been running things over 40 plus years. And this is particularly important and good treat for us here because part of the suite of different businesses and organizations and institutions that we're highlighting here at SeeJeanty Media, a medical facility was very high on my list, and we're here and we get to do have a conversation. This is what we do here at SeeJeanty, by the way. We go all across the world, in Haiti, anywhere else, America, Europe, Latin America, and we connect with change makers to really inspire, to really encourage you, the viewer, to take action not only in improving Haiti, but improving the little Haiti community that you may be nearby or a part of. Listen, I'm not gonna stand too much out here. There's so much cool stuff to show. There's such a great conversation we're gonna have once we get in there. Let's go. And the first stop of any visit is the visitor's room. Of course, you have your usual staples. Good stuff to read, water, coffee, television, but most distinctly a photo of Dr. Harry Jean-Marie Marcelin to greet you, the forefather of the office. Very friendly, cordial, administrative nursing staff here to greet you, ready to help you out with whatever ailment or issue you may have, right? And I can say that's one of the really important things of any doctor's office I've been at is when you first come in, you begin that sense of being welcome, getting the sense of, hey, you're gonna be taken care of, and of course, feeling and being comfortable. And I think they hit all the check boxes in that experience. But I think what's really important here is when you have your own office, if you're watching this and you think about maybe I wanna do my own office, it's really having those people come in feel as if they're welcomed, they're appreciated, as really the first step before anything else. As we're sitting here in one of the patient rooms, I can't help but reflect how much within the past year or two under a new administration, things have changed within the medical sphere. Medicare, Medicaid, a lot of things have changed for the most needy. And as a whole, insurance has become more expensive, as you can imagine, but the need is still there, right? Especially amongst our community. You look at all the statistics in terms of diabetes, conditions, early death, sickness, and life expectancy. Across the board, our communities are some of the highest affected. There isn't a clearer directive, I think, for us in our communities as we talk about economic progression, as we talk about the capacity to be self-sufficient within our country and ourselves. The health, again, is just, with no health, there is no wealth, right? And so the need for someone like you who's watching to say, you know what, I'm going to take the charge from a medical perspective and see what I can provide. There's no words to express how appreciated that activity and that level of action is. With SeeJeanty, of course, we visited some of the most affected communities in Haiti, but yet there's equally affected communities here. As we're talking to you, we're in Lauderdale Lakes, not too far away, and in Broward County, some of the most disenfranchised people live in blocks not too far away from here. So, and I think you, if you're watching this, your chances are you know exactly which community, where the communities that are most in need are. Setting up a shop there today, or within the next 5-10 years after you finish medical school, right? Absolutely crucial, absolutely needed, and that is exactly what you should do. Of course, the best part of the episodes that we do here are the conversations we're able to have with the responsable. And this episode is no exception. We're sitting right next to Dr. Harry Patrick Marcelin. Thank you so much for your time here. And I think you let me call you Harry.
Yes, yes, please do, Chris. Please do, Chris.
So it's not out of disrespect, okay? It's out of cordiality. Thank you, Harry, for allowing us to be here. Your office, I'm just looking around and I feel the I guess the empowerment that happens here, community has been how long in total? 30, 40? How many years would you earmark the clinic has been gestating? At least your father's been in practice and helping the community.
So specifically on this site here over at St Croix Medical Group, it's been since 2009. Mm-hmm. But my dad, just practicing in the South Florida area, he's been here since the 90s practicing when he started.
From the 90s, and of course this particular office. So the conversation we're going to have here relates a lot to, it's an interesting time, as the medical field. There's so much changing, Medicaid, Medicare, who's running the particular Department of Health in the country. And so we have so much we can talk about. We're going to try to condense it and keep it short, specifically as relates to our community and how, we are able to impact it through engaging it and potentially setting up, very similar institutions like this all across. So let's start off here. Who are you? And walk folks through how you got to this point where you're sitting in front of us today.
Sure, but first off, let me just thank you, Chris, for what you're doing with the community, the outlet that you've been able to establish with your SeeJeanty TV. It's phenomenal. I've been able to watch a few of your episodes. I think it's great just to learn myself all the different things that are out there, all the different ways that Haitian entrepreneurs are trying to establish and reestablish what things are, to be able to break the stereotypes that people hear about, but you having that first person view into what is actually there, like the videos that you have in Haiti. I think those are wonderful. I think being able to bring out what we are doing here in the States, you are allowing people to see what the real thing is versus what people are hearing from the main media. So I'm humbled with what you're doing. Thank you so much. But a little bit about myself. So again, my name is Harry Patrick Marcelin. I'm a pharmacist by trade. I had the fortunate opportunity to be able to be raised by two wonderful parents. Both of them are, Haitian born, came over and immigrated to the States as teenagers, and starting off with the grandparents having a vision of trying to do something better for the family. So, them being able to, they met each other over in New York, and my father, of course, was a physician, mom's a nurse, and just through their story and their background, being able to figure out how they can be entrepreneurs, how they can do what they need to do to make a better life from us. Mm-hmm. So, born in New York, moved down to South Florida around the age of 3. And very fortunate through that time frame, being able to watch my parents grow, being able to watch them teach us what it means to be smart, intelligent, well-rounded individuals, the sacrifices they did with being able to put us in the schools that we're in. And now at this point, it's so surreal. Now it's our turn doing that. And it's one of those things where it's just the culture, it's just the background in that foundation that's been able to bring us to where we are now. As I said before, I started off as a pharmacist, still a pharmacist now. Went to pharmacy school in North Carolina, did a 2-year pre-pharmacy degree at the University of North Carolina, Chapel Hill, graduated with my PharmD in 2008, did a 2-year residency over at the University of Kansas Medical Center, and I trained to be an administrative pharmacist. You know, in 2021, you know, the path changed. My father, he ended up passing away in 2021, and this wonderful practice that he had established, you know, there was a conversation with the family trying to figure out, well, what is the next step? What are we going to do? And I remember on my father's deathbed, you know, we were having conversations, and one of the things that came up is, what do we want to do with the practice? Do we sell it? Do we keep on? And we asked him, hey, do you want us to sell it? And he would not answer. And, you know, when I remember that moment and looking back at that, that was his way of letting us know, like, he did not want it to go away. I had an opportunity as my dad was going through his illness, coming to the office, you know, starting to do some of the managerial items, being able to reacquaint myself with the staff here. And all of them were like, you know what, your dad would want us to continue on doing this. I mean, so many people depend on him. So many people come here because of him and what he's been able to do to the Lauderdale Lakes community. You know, he is somebody that is well respected, and you just can't let that go.
So no, that's you know, very interesting, because effectively, you know, what you were doing before, it wasn't private practice, but basically in 2021, you basically got into private practice and you had to learn the ropes from there. So what were you doing right before, and then that journey in terms of what big differences between what you were doing before and private practice? I think that would be very informative for folks to understand, like, what they themselves need to get ready for if and when they want to start their own private practice.
Sure. So before, you know, I had the blessing and I had the opportunity to be able to work for, you know, a hospital-based institution. And as an employee who works your typical W-2 job, you know, you have your responsibilities, and my responsibility was to be a director of pharmacy, be responsible for pharmacy personnel to make sure that the operations and distributions of pharmacy practice were being able to be upheld to the utmost importance to make sure that patient care is provided to the end user, which are our patients. That's the whole reason why we're there. So the similarities are that we're still trying to take care of patients. When you're in a hospital setting, the purpose of being in a hospital is whatever that acute or reason why somebody is going into the hospital, you fix that, you stabilize them, you make sure that they're okay. And once they're okay, then they go back home and they are then followed up with a primary care physician. When you're working for a primary care facility, that's more of the day-to-day things. So I come in with my routine checkups, you know, I do my blood work, you know, the doctor asks you some questions just to make sure that you're doing well overall. You look at labs to make sure that with those labs that you are what you're supposed to be doing. And then based off of what you see in those labs, or based off of how you're presenting to the provider, that provider is going to give you a recommendation of something to fix. But these are generally, they can be like short-term things, something like, you know, I have a little ache or a pain, or I have a little sickness, but those are generally quick, easy fixes that you can do just to make sure you're okay. But then you also have chronic illnesses that you have to manage. And the chronic illness is going to be some sort of illness that you're going to have maybe from months to years to life. Now, when you're a primary care physician, your goal is to make sure that whatever comorbidities or sicknesses that you have aren't going to go any worse, and that you are trying to make sure you're stabilizing those conditions so that patients can have an overall general well-being. You want to make sure that you slow down that decline, or you actually improve so that you're better. When you're working at a primary care office, you've got different types of practices. You've got for-profit practices, which are going to be practices that are individually managed, or practices that are not affiliated with the government or the state. They're just run by people or corporations. And then you have not-for-profit primary care centers, which are going to be your care centers that are generally going to be run by maybe a hospital or maybe by the government. You may have hospital districts like the VA who, instead of trying to, in order to prevent people from going back into the hospital, you take care of them, you make sure that they're okay before they go back into the hospital. Right. But when you're looking at, just the medical profession in general, I didn't know it before you ran, but you've got to be able to make sure that there are some finances, there is business in there, because you need to make sure you have enough to, one, keep the lights on. Right. You need to make sure you have enough to make sure that your employees are taken care of. And as an owner, you tend to make sure that all that stuff is taken care of before you're able to take care of yourself.
Right. So there's that legit business side, that you have to, in addition to the medical side, there's but it's not like you go to school for business. You go to school for medical, but that, how do you get accustomed to that piece of it, the business side of it? Unless the school had a business side to it, I don't know. Well,
it's interesting because for me, I went to pharmacy school. I didn't go to medical school. Medical school and pharmacy school are two totally different things. A pharmacist cannot be a physician. It's one of those things where, I can generalize in general just with schooling. Most of your schooling, whether you're a pharmacist, whether you're a physician, whether you're a nurse, a majority of that schooling is going to be you learning how to do the quote unquote clinical things, the medical care piece. There's a very small amount of time that is spent on the business side of things. Because if you were to focus on that, then medical school, pharmacy school, nursing school, you'd easily double the amount of time there is, because there is just so much in that business field that you don't know. And maybe you get an MBA, so you'll see a lot of people who are going back to school now to get their MBA so that they're able to learn and understand how business works. A lot of people, maybe what they do is they work under somebody, and then as they work under somebody, they learn the business side of things. But for me, a lot of it was just being thrown to the wolves, and
just learn as you go.
You get thrown into the water and you hope you float and you come out. So it was a very quick, fast course in learning how and what medical practice is. I mean, the medical side of things, I can speak medical terminology because I'm a pharmacist, but the business side of things, it's totally different. And the people that you work with probably aren't going to know that stuff. So a lot of it is you learning on your own and figuring things out, which is tough.
You mentioned you and your brothers used to play here. Now your brothers, are they involved in the practice, and how much do they help in terms of managing? And also you mentioned, since you're a pharmacist, do you have a physician do you work with, or how does that work in terms of your brothers, or is it someone that's a part of the staff that handles that piece of it? How does that work?
Sure. So my two brothers, I've got a brother that is a podiatrist, and then I have a brother that is an anesthesiologist. And my sister, I've got an older sister, she was involved in the medical field, being able to, just a patient care advocate, being able just to care for patients that are sick in the hospital. So between the three of them, and then my mom being a nurse, I'm very fortunate to have, I almost call it like a board of directors, because
they all have different inputs they can
everybody
provide.
has inputs, everybody is involved in the medical profession. So because of that, and because of the fact that we all do different things, that culmination of minds together really helps us see things, I think, differently than other people do.
So you mean to tell me, of all your siblings actually achieve one of the prestigious career paths that all Haitians want, their kids to go to. They all became doctors in some fashion. Is that right?
Everybody is involved in the medical field, and it's
That's
again,
good.
and that's where we learned from. We saw my mom, we saw my dad,
Mm-hmm.
and from them, they're the ones that kind of laid out the blueprint.
Mm-hmm.
But I'm very fortunate because I have my family to be able to bounce ideas off of. We meet routinely to discuss, hey, what's going on? You know, when I have questions or issues, like Marvin, the podiatrist, he runs his own podiatry practice up in Philadelphia. And, you know, with him, he has that business acumen. He's got that understanding of how things work. So in the very beginning, I was fortunate because I had a trusted resource to go to be able to guide me, to be able to mentor me, to be able to come in and really help me, give me a quick crash course on what to expect and what to look forward to. So for me, I'm very lucky because I had people that I could trust because, you know, we've just been through everything. And then I was fortunate to have some resources just from people who knew my dad so closely. They were able to help us with making sure that we weren't going to be, you know, taken advantage of. You know, they gave us little quick crash courses. I would meet routinely with them so that they would help me make sure that I was at a certain level. And before you know it, as long as you're there long enough, I mean, you know this as an entrepreneur, you know, as long as you're consistent, as long as you put that time in, you really are going to get out what you put in.
And you get there.
And for about 3 years, it was pretty much me being here, you know, 40 plus hours a week, trying to get it to a certain point. And, you know, now 2025, you know, I think we're getting close to where we need to get to, which
awesome. That's awesome to hear.
Is just blessings and blessings.
That's awesome. I guess in terms of the other clinics, what do you feel you're doing a little different here versus other clinics?
The model of primary care nowadays, like, you don't see a lot of individual mom and pop run practices anymore. A lot of the practices that you're starting to see now, they're part of big chains. You know, when you see competitors that are out there, these competitors are multi-system clinics, and they have locations in multiple areas and in multiple locations. And when you see those type of practices, I think there are strengths and there are weaknesses in those. You know, the strengths are that they have a lot of the market share, they have a lot of the contracts because they see a lot of the people. But a lot of those practices are almost like factories, because with those practices, you're not necessarily a human being, you're not a person, you're a patient, you're a number. And it's more like coming in, coming out, workflow, and it's not individualized because, you know, there's so many people that are in the waiting room, and there's so many people that are calling trying to get appointments. And, you know, sometimes I hear people saying, man, I just can't get an appointment to go to a doctor's office. And because a lot of that is, it's run by a business person who happens to maybe have an affinity to medicine. And the way that I try to look at this here is that we're a medical practice. We need to make sure that we pay the bills, but, you know, our motivation is your health. That's the motto of St. Croix Medical Group. And for us, we're not that practice that are going to have millions and millions of people that are coming through. You're going to have like 40, 50 people waiting in the waiting room. You're going to have 20, 30 physicians that are in a practice. We are an individualized practice. We do truly see each person as who they are. They're not just a number. We spend a lot more time with our patients than maybe some of your other practices. Maybe, I don't know what your past experiences have been going to a physician practice, but I've been to some physicians where you go in, you maybe see the provider for 2 minutes, and the majority of your time that you see the provider, the majority of the time that you're in the actual practice, you're
in the waiting room or just waiting.
Exactly. And for us, you know, our thing is our practitioners sit and talk with the patient. We not only get to know the patients as, you know, who they are as far as, you know, their diseases, their sicknesses, and we try to heal them, but we know them as people. Like, we have patients that fortunately they've stuck around with us that have been here from when my dad had his first practice over in Sunrise, when he was there in the 90s, and they followed him. The reason why they followed him is because he treated people like people. So when you come to St. Croix Medical Group, you're not going to be somebody who's going to be fast-tracked in and out. You can expect to have a half an hour conversation with the provider, what's going on. You talk about life, you'll talk about kids. My dad was notorious for this. Like, the majority of his time with his patients were probably spent outside of talking about medical things. It was more of, who are you? What's going on? Are you okay? How are the kids? How is the family? All right, let's get this medicine and stuff out of the way. But most of the time, the patients would come not to necessarily get checked out, even though that is the priority of why you stay, but more of being here because we treat people like people. So I think one of the things that separates us is we see you. You're not going to be rushed in and out when you need to see the doctor. You're going to get a thorough evaluation. We're not going to say, hey, I've got somebody who's waiting and you need to get out of here. We're going to give you your time. And once you're done, then we'll see you next time. Mm-hmm. Now that can also be a weakness because you have people who are waiting, but they're upset maybe before they're waiting because they're wondering, why am I not in here? But once they're in here, they're happy. And they realize, well, now I understand why so-and-so was here before for so long, because I'm getting that same respect. I'm getting that attention. And that's something that people won't see at other institutions.
For the Haitians that might be Indiana or Ohio or a lot of the, heck, even Little Haiti in Miami or New York or even the communities in Canada, what would be the biggest advice? Because again, you're in a fantastic position to provide this advice as someone who, again, recently, 2021 to today, taken over private practice. And again, your answer is related to the difference maker here has been so eye-opening for me, for sure. But what advice or what words, what advice and or encouragement would you provide someone in that community, in a community like that, to push them forward so they could do something like you're doing here? What would you say to them? Someone maybe on the fence over there thinking about doing something like this.
Well, I think for me, and our culture in the Haitian community, we have a very resilient culture. Learning and knowing who we are as an individual, what we've gone through in the past, what we're still going through now. Our parents just won't let us fail. They've instilled in us discipline, responsibility, working hard. And I think that as whether it's immigrants or first generation, I think that passion, that fervor to succeed no matter what the odds are is so strong. I mean, that's what I was taught. I mean, I was, again, born in the States, but being able to realize that one generation ago, seeing what my parents had to go through to get us here, that's still fresh in my mind. And it's one of those things where, again, my family's I've been very blessed to be able to be in a situation that I'm in, but at the same time, I still saw what that was, and everything that they've done to give me an opportunity to have a leg up, to try to move up in the world, is something that I just will never forget. I think that, no matter where you are, having that culture, appreciating where you came from, appreciating that drive, because not all cultures are like that. Not all cultures have that hardworking, I'm gonna do whatever it takes to come up, or you saw everything that I did, so you better make sure that you have that and then you grow it type of mentality. I myself, I went away for college. I went to try to educate myself outside of South Florida, and for me, it opened my mind, it opened my eyes, and I kind of used that as an opportunity to let me learn what other people are doing and bring that back. I went to school in North Carolina. Mm-hmm. I learned how the pharmacy practice was in North Carolina. Mm-hmm. I got to see the best of the best, the brightest, in my pharmacy class. These were some very intelligent individuals, and I worked very hard to get to the point where I got to get my degree. But I think that what I learned, I was able to bring back here, mm-hmm. and I think that was incredible. So no matter where you are, whether you're still in the South Florida area, whether you're in the Midwest, I think that in whatever you do, and my mom always told me this, whatever you do, you just try to be the best at what you can. You try to go somewhere and you learn, you get that best education that you can, and then you bring that back. So, if you're in a rural area, you don't have an area that's close to you and you want to do training, you go to whatever area you need to get to. You do the training. If you like whatever area you settle in, then that's cool. Then stay there, you're fine. If you want to come back, it's even better, because now you get to come back, you learn whatever you learned over there, you bring it back here, and you start setting that up. I think the second thing that I would tell people is, you're not gonna get this overnight. It's gonna be a day in, day out challenge. Like again, it's only now I feel, going on 4 years of doing what I'm doing, that I'm reaping the benefits of what I was doing in year one, in 2021. That 2021 work, it took 4 years to 2025 to finally see that. So the second piece of advice that I would give people is, again, you've got to be disciplined. You have to be consistent, day in and day out. You're not going to see those gains. It's almost like somebody who's going through a weight loss journey, or somebody who's trying to get strong in the gym. You're not going to see those results, day 1, day 2, day 3. It's going to be month 1, 3 months, 6 months, a year. And then you look back and you see that before picture and you see that after picture.
Wow.
It's a totally different story. So I think for me, it's just being disciplined. It's always saying yes, not being afraid to reach out to mentorship, not being afraid to ask questions. If you see somebody that you want to emulate, don't be afraid to go to that person and say, you know what? I want to be like you. What can I do to get to your point? Very rarely will somebody say no to you if you actually mean what you say and you are willing to put the time and the energy and the effort. If you go in, you want the blueprint, you ask somebody, hey, give me the blueprint, and that's it, then you're probably not going to get that. But if you're showing up day in and day out, weeks, months, you'll get that education, you'll get that knowledge. They'll want to mentor you. And then you do that for a little while, you'll realize, hey, you know what, it's not as bad as I thought it was. And then third, having a support system. A support system is the greatest thing that you can have. There were days and nights where I'm thinking to myself, am I gonna let my dad down? Like, these numbers aren't moving. Are we gonna be able to keep the practice open? Am I gonna be able to keep the employees here employed? Is the work that I'm putting into here gonna be worth it? But, I'm very fortunate. I have a loving wife who has always been my biggest supporter. She's been my cheerleader. She's the one that, helps me realize that, you do what you need to do and you'll be okay. And if it wasn't for her, I wouldn't be able to step back from what I was doing in the pharmacy, because again, the income was a little different. I'm going from having a W-2 paycheck, being able to have a steady income, to my wife is being the breadwinner, giving us some time to get this practice where it needs to be. So whether it's me being fortunate to have my wife, me having
your brothers too.
My brothers who are there,
you reached
me
out
having
for
the mom,
advice.
me having my sister, of course, having my kids, realizing that if I can't make this thing work, I can't not make it work, because I've got a legacy that I've got to make sure that I continue to have. And these individuals are looking to me to make sure that I'm continuing the legacy that my dad had. So I think having a little bit of an initiative and having that support system is probably the third thing that I would say helped us get to the point that we're at now. But we're not there yet, but day by day we're getting closer
Deep
and closer.
and detailed answers. We appreciate it here. Those who are watching, taking notes, much appreciated. And really the last question I have, and this will put you on a hot spot, because as a pharmacist, you have in-depth knowledge of things people can consume and maybe put on them that is helpful. And Haitians, we have many things that, rightly or wrongly, we use castor oil, Vicks.
Vicks for everything.
Well, what sort of? It's just a really fun question, kind of, but still, like, what are some of the home remedies that are so popular that are also, you would say, actually good? That you maybe would even recommend, depending on the severity of what it is. One example, what's something that actually isn't. Is it castor oil? Is it Vicks, or is it something else that maybe you actually would recommend, depending on the?
I mean, my mom, because this is where I get all the remedies from my mom, and my mom is a true believer of the vitamin C. She is a true believer of, so once I get that little itch, better get that vitamin C, start taking that vitamin C.
In the form of tea maybe, or just straight up?
She'll do the straight up stuff, she'll do the tea stuff. My mom also is an onion and garlic woman, so for her, she'll have all these concoctions and stuff. But I think for me in general, some of it, if it makes you feel better, I'm not talking about like, crazy, putting random stuff in your body, but taking your vitamins, you'll be surprised at how far that comes.
Some of those common sense
stuff. The other stuff, if you're not doing too much of it, if it makes you feel better, but you're also making sure that you're isolating yourself when you're sick, you're getting rest, you're drinking your fluids, the electrolytes, a lot of that stuff, what ends up happening is it's not necessarily preventing, it's just helping you replete whatever you're losing to make sure that you're able to get that immune system fighting so that you're back to where you need to get to. So for me, I mean, the vitamin C has always been one of those go-to things for me to help you out, whether it's just drinking a bunch of orange juice, whether it's getting that freshly squeezed stuff and eating those oranges. I think that's something that has always done me okay. And
boom, Harry, listen, appreciate the time, the breakdown, and we're gonna put the address of the clinic here. And if you're in South Florida, it's worth the drive. It's pretty central. No matter north, south, pretty central where it's located here. I can tell you the facilities are top notch, and then the staff here are. Again, I met the nurse who was here earlier. Friendly, absolutely friendly person, and I can tell you that. You'll be in good hands. You'll be in good hands. And again, thank you again for your time today. And I know I learned a lot. And this is exactly the sort of episodes we do here at SeeJeanty. If you like what we broke down, if you like what we talked about, please make it a point. Hit that subscribe button. Share this video. And we'll be back at it again. We're back at it again. Take it easy, guys.